Hello, my name is Donovan Straczynski. I am a hack nursing student, and today I'm going to be doing a assessment scenario. So first I'll begin by reading my scenario and stating the abnormalities in which I find. Madeline Thompson is a 70-year-old female who presents with complaints of blurred vision and left-sided facial paralysis. She is able to walk, but the nurse notes that she is unsteady. Mrs. Thompson's speech is slurred and she is crying. Her husband tells the nurse that his wife is active and volunteers at a local term care facility. Her temperature is 99, her pulse is 100, her respirations are 24, and her blood pressure is 160/94. The abnormalities I find are blurred vision, left-sided facial paralysis. Also, she is unsteady when she walks and has slurred speech. Based on my findings, I will be performing the Neurological 2 assessment for this patient. And today helping me out will be my mom, who will be playing Madeline Thompson. And so I will begin. First, I'm going to perform hand hygiene. I'm going to do my 2 patient identifiers. Will you please tell me your name and date of birth?
Madeline Thompson, 6/28/71.
Is this room private enough for you? Do you feel like your
Yes.
privacy is being violated? Is it okay for you?
Yes.
Okay. And do you have any allergies to anything?
No.
Okay. So today, I'm going to be performing a neurological assessment on you. Is that okay with you if I do that?
Mm-hmm.
So tell me a little bit about what's going on. When did this start?
Today at work.
Okay. Where are you having this problem?
Well, my vision is blurry. My left side, it just feels numb. And I feel like unsteady when I walk.
Okay. How long has this lasted now?
Since about 1 o'clock today.
Okay. Can you describe how it feels? Do you feel pain or do you feel numbness?
Yeah, I feel numbness. Don't feel right.
Okay. Is there anything that makes it better?
No.
Is there anything that makes it worse?
No.
Okay. Have you tried anything for this in the past? Have you had this in the past?
No.
Okay. On a scale of 1 to 10, how much pain are you in?
No pain.
Okay. Alright, so that gives me a little bit better idea of what's going on. So I'm going to start my neurological assessment, but to start, I have to ask you a couple questions that I already did. Is that okay?
Yes.
Alright, who are you?
Madeline Thompson,
And your date of birth?
6/28/71.
Okay. Where are you?
In the hospital.
And why are you here?
I don't feel right. I feel numb on my left side and I can't see right.
Okay. Alright, so first I'm going to have you do a walking test. Can I have you stand over here for me, please? Alright, so first I'm going to be performing the tandem walking test to get an idea of how her gait is. So I'm going to support the patient here, and what I'm going to have you do here, Madeline, is have your heel touch your toe, and you're going to walk in as straight of a line as you can with your heels touching your toes. Excellent. Thank you so much. I'm going to have you stand back over here. So she walks without shaking. The feet went in front of each other with no space in between. So now I'm going to perform the Romberg test. For this, it's assessing lower motor function. And so what I'm going to do is just have the patient just stand still like this, arms relaxed, standing in a normal position. What I'm going to do is I'm going to look for any shaking or kind of wobbling here. And I'm not noting anything. And now, if you would close your eyes for me, please. And again, I'm looking for kind of the same thing to see if there's any abnormal swaying or shaking. And I'm not finding anything. Okay, thank you so much. And you can have a seat right back down here. All right, so now I'm kind of going to go over some of your fine motor skills, okay? And so what I'm going to have you do is have your hands up like this, and if you can close your eyes and touch your finger to your thumb, each one after another, like this. All right, but make sure your eyes are closed when you do it. Okay, she's able to do each finger. She's not missing any. Good. And that looks good. All right, great. You can open your eyes now. So now again, for this, I'm going to need you to close your eyes, but don't do it now so you can see what I'm doing. I'm going to have you lie your hands on your legs like this, palms facing up. And what I'm going to have you do is just flip your hands up and down as fast as you can. Okay, again with your eyes closed though. All right, so it's going to look like this. All right, so if you close your eyes, I want you to try to do that. Excellent. She's not missing her legs. She's going up and down. She's able to flip her hands evenly. Excellent, thank you. All right, so for this next one, what I'm going to have you do is I'm going to have you take your fingers and you're going to just touch your nose like this. So to get, just like this. Keep your eyes open for now just so you can get a feel. All right, so now what I'm going to have you do is why don't we stand up. All right, so now you're going to do the same thing, but close your eyes and touch your nose. Good. She's not missing her nose. She's able to do left after right. Good. Excellent. Thank you. Another seat. All right. All right, so for my next assessment here, I'm going to have her touch your nose and then to my finger right here. And this you have to keep your eyes open for, obviously, to touch my finger. Excellent. Now I'm going to move it, and all you got to do is just follow wherever I move. Good. And now she's able to touch my finger. She didn't miss anything. It looks normal. So now what I'm going to do is the pain and sensation part of the assessment now. So what I have here is a tongue depressor. One side is sharp, one side is dull. I'm going to have her stand up, please. All right. So close your eyes. All right, and tell me which side you feel.
Sharp.
Again?
Soft.
Okay. Again?
Soft.
Good. And one more time.
Sharp.
Good. So she's able to feel the sensation without looking at what I'm doing, and on the extremity that I'm doing it on. So for my final test, what I'm going to have you do is, if you could please take your shoe off for me and your sock. All right. So now for this test, I'm going to have her hold her hands out, and I'm going to move her fingers up and down to see if she can feel what position her fingers are in without looking at them. I'm also going to do this on her toes, but I'm going to start with her fingers here. I'm going to do each one. All right. So if you'll please close your eyes, and I'm just going to move your fingers one way, and you just tell me what you feel. All right?
Up. Down. Up. Down.
Good.
Up. Down. Up. Down.
Okay.
Up. Down. Up. Down. Up. Down. Up.
Okay. So now I'm going to do the same thing on her toes, and I'm going to try to get the camera. You can move your foot. Okay. So I have this foot here. All right. I'm just going to take a toe. Close your eyes, please. And I'm just going to do the same exact thing to see if she can find where I'm positioning her toe.
Up. Down. Up. Down. Up. Down.
Great. And now I'm just going to do it again on another toe. Same exact thing.
Up. Down. Up. Down. Up. Down.
Good. So she's able to identify where I'm moving her fingers or toes without looking at them. And so, overall, this assessment was normal. She's able to walk, and her sensory seems very much intact. So again, my name is Donovan Straczynski, and this was my neurological assessment video scenario. Thank you.